Welcome back. He is not only a good visionary on what the world can be, but he is extremely good at making it happen, wrote the renowned management guru C.K. Prahlad about Dr. Devi Shetty in his bestseller, Fortune at the Bottom of the Pyramid. To get a good understanding of Dr. Shetty's healthcare model, Veena Krishna camped in Bangalore and talked to doctors and patients in Narayana Health, and finally caught up with the man himself to find out how he combines passion and business. This is what Dr. Shetty has to say. Take a look.
Okay, Dr. Shetty, Mr. Uppal, thank you for joining us. Dr. Shetty, a Robin Hood cardiac hospital that charges wealthy patients but equally welcomes the destitute. How and why did you think of this model?
This is the only solution for a country like ours. We need to do over 2 million heart surgeries a year. Today, all the heart hospitals in the country put together perform less than 100,000, 110,000 heart surgeries. What happens to the rest? They perish gradually over a period of time. And who are those people? They are the young breadwinners of the family. In the process, we perhaps produce the largest number of young widows in the world. How long you are going to tolerate it?
Okay, so you have kind of beaten all the inflation theories. Cardiac surgery that cost 1,50,000 20 years back. Today you're able to charge 80,000 rupees. How do you work on this economies of scale model?
Health sector is very sensitive to the numbers. As you do more operations, your results get better, your cost goes down. Today, our group does approximately 10% of the heart surgery done in India is done by us. So, for any seller of the machines or drugs or any of those, they straight away capture 10% of the market if they start selling it to us. So, they have been very nice to us because of our volume. The whole thrust is, if a solution is not affordable, it is not a solution. So, we build large hospitals like where you are sitting today. This is a 3,000 bed health city. Our target is to convert it like a 5,000 bed health city, have about 10,000 to 12,000 outpatients visiting us every day. Then the revenue you generate in the outpatient alone is sufficient to offer virtually the inpatient services free.
So, Mr. Uppal, as a banker, how do you view what Dr. Shetty calls a Walmart approach to healthcare? How do you view this model?
Now, clearly there is a huge demand, and as a banker we are a bit more cut and dry, so I just like to look at it like any other sector, that given the population of India, there's always a demand but affordability kicks in big time. And to make a value proposition at that level of affordability, you have no option but to go for volumes here. And then you have to organize things at an industrial scale. And probably that's what works for NH, and that's what they're looking to achieve.
So, Dr. Shetty, in 2001, you became an entrepreneur because you said your employers did not understand you. What did you mean by that?
I left England in '89. Then I worked for a large industrial group in Calcutta, in Bangalore. They have good intention, but this is not their main forte. This is like a side attraction. They just want to do it to have a feel-good factor. And I realized that unless you take it up like a very serious business, you won't be able to challenge the norms. And we realized early on that economy of 21st century will be driven by health sector. This is the industry which is going to create the maximum number of jobs, and maximum number of people will need this service. So, we realized that we need to come up with a different solution, which may be premature 10, 12 years ago. So, it is difficult to make others to understand. So, we thought let us jump into it and make it happen.
Okay, so you've done 13,000 surgeries and close to 50% is on children. So why did pediatric surgery become your focus?
Pediatric cardiac surgery is one of the most complex procedures on the human body. In simple terms, like operating on a child who's newborn is like, and compared to an adult who's undergoing a bypass, is like the difference between repairing a wall clock from a wristwatch. It requires a different set of skills. It's very challenging. And more than anything else, there is no money in pediatric cardiac surgery in this country, because when a couple has a young child, they are in their 20s, they won't be able to produce 2 lakh, 3 lakh rupees for a heart operation. So, it fascinated me because I love children, and it's very challenging, and when you do it, properly, you have outstanding outcome.
Okay. So in this background of always trying to serve the poor, you're also making a profit and loss account every day and giving it to the doctors. Again, how do you really manage that?
Veena, you have to understand that charity is not scalable. Good business principles are scalable. Money doesn't come from heaven. If you respect money and use it judiciously and make everyone aware, not at the end of the month, you should make them aware at the end of the day. Every day at 12 o'clock in the afternoon, all the senior doctors, senior administrators of our group in 21 locations get a SMS on their mobile phone with yesterday's revenue, yesterday's expenses and the EBITDA margin. For us, looking at the balance sheet at the end of the month is like reading a postmortem report. You can't do anything about it. Whereas reading the P&L account on a daily basis is a diagnostic tool. So you can take remedial measures. When you are running a business with a wafer thin margin, you are constantly trying to keep your nose above water. So it's very, very important that people who handle every catheter knows how much it costs. When they finish a heart operation, they should know how much money they have spent.
Okay, so Mr. Uppal, as a banker, how do you look at this? Have been the old Marwari tradition of charting out P&L every day. Would you say other companies do it or should emulate this?
I would agree entirely with Doctor that if you have to make it scalable, you need a model which generates profitability. You can obviously drive down the cost through the scale you have initiated because that's the affordability. But to make it a scalable model, you have to have a business model which is profitable for it to generate business to sustain itself.
So that's what, like, you know, I heard the BBC Heart Talk interview that you had, and I was surprised a little bit with the opening line that the anchor took, that your international reputation rests less on your medical skills, but more on your business brain. Would you want to be looked at as a businessman or a surgeon?
I was never a businessman. I have no desire to be a businessman. I'm a heart surgeon. I want to continue with my passion of heart surgery. But I am surrounded by extremely smart people who are very, very good business people, and they do a great job, and I always support them, and I bless them and request them to allow me to enjoy my work.
So you also want to now set up an hospital in every emerging economy of the world. Why do you desire to go global? Why the need to go global?
I think India has an obligation to other developing countries, because we are fortunate to be producing 28 million babies a year. No other country in this world produces that many babies. And by the age of 22, 23, they can be made as fantastic healthcare professionals. And these kids, when they grow up, they need employment opportunities. It is very important for all of us to understand that the future threat to India is not external enemies. It is going to be the unemployed youth of this country who will destroy the country if you do not give them a meaningful job. In terms of potential to create maximum jobs, healthcare has surpassed all the other industries. In the last 5 to 7 years in the US, only industry which created job is the healthcare industry. You look at our country, IT industry, which gets phenomenal support from the government. For 1 crore rupees turnover in IT industry, they need to hire 5 to 7 bright engineers. For 1 crore rupees turnover in health sector, we need to hire 250 people. And IT industry hires engineers who come from middle class and upper middle class families. We hire nurses and technicians who come from lower socioeconomic strata. So if you want stable country, you need to look at inclusive growth. Inclusive growth will only happen if you create jobs, meaningful jobs for children coming from lower socioeconomic strata.
Okay, so from 280 beds in 2001 to 30,000 in 2020, what is making it big mean to you, Dr. Shetty?
That's the only way to serve the 1 billion population you have. We need to create 2 million beds in this country. So where is 30,000? For the 2 million beds what is required? It's a very small percentage. But someone has to dream big. I really don't know whether I will ever reach there, but there is always an effort and there is a need.
Okay, Dr. Shetty, thank you for joining us. Mr. Uppal, thank you for joining us.
Well, that was Dr. Shetty articulating very passionately his life's mission without losing focus on top line and bottom line. Here are the mantras Dr. Shetty implemented to build Narayana Health. Successfully adopted economies of scale model. He did a Walmart in healthcare space. Sweating of all assets. This includes men and machine. Working out profit and loss account on an everyday basis. Using brownfield route to grow the business. And finally, forging partnership with specialists in the healthcare sector. Well, those are the mantras that have helped Dr. Shetty create world-class healthcare facilities for the poorest. Impressed by his model, Harvard did a case study on Narayana Health a few years back. To recap what Dr. Shetty said, passion is the raw material, the financial are the byproduct. On that thinking note, it is time to say goodbye. See you next week with more such stories. Till then, keep watching CNBC TV 18.
Focus, ideate, innovate, enable.